Understanding your risk. Do I need to be screened for PAD? Peripheral Artery Disease, or PAD, is the most debilitating disease many people have never heard of. PAD impacts more than 12 million people in the U.S. and occurs when the legs or arms don't receive enough blood flow to keep up with demand. This can cause leg pain or cramping when walking. PAD is also one of the leading causes of amputations in the U.S., making early diagnosis and treatment critically important to saving a limb and a life. This is especially true for Black and Hispanic people, whose risk for amputation is double to quadruple compared to white people. Black people and Hispanic Americans experience PAD and its devastating consequences more frequently. Luckily, PAD is not a death sentence. It can be managed if diagnosed early. Getting a pulse on your PAD risk is a good first step. 4 leading medical societies have joined together as the PAD Pulse Alliance to encourage people to get a pulse on PAD. There are many risk factors for PAD. Tobacco use, including smoking and chewing, diabetes, and high blood pressure are the biggest risk factors for developing PAD. Even where you live can increase your risk for PAD. Your family health history can also increase your chances of developing PAD. Kicking off the conversation is a great way to understand if you or a loved one are at higher risk for developing PAD. Asking about family members who have heart disease, diabetes, kidney disease, or an amputation are all important things to know when gauging your own personal risk. Many people think leg pains are common as you get older. However, it could be a sign of something much worse. Leg pain while walking that gets better once you sit down is a common symptom of PAD. If you experience leg pains while walking, muscle weakness, sores or ulcers on your legs or feet that won't heal, or cold or numbness in your toes, it's important to talk to your doctor. Don't let PAD stop you in your tracks. Start the conversation with your doctor if you think you are at risk, especially if you have a wound that doesn't heal. Understanding what PAD is and thinking you may be at risk can be overwhelming. Before meeting with your doctor, come prepared with questions on hand to make the most out of your appointment. If your doctor thinks you may be at risk for PAD, they may do an ankle brachial index or ABI test. An ABI test is a quick and non-invasive way to know if you have PAD. A nurse or doctor will put a blood pressure cuff around your ankle while listening to your pulse in the arteries that supply blood flow to your foot. If your blood pressure is lower in your leg compared to your arm, this can indicate narrowing or blockage of the arteries in the legs. Starting the conversation around PAD with your doctor is an important first step in your PAD journey. Visit padpulse.org to learn more and access additional resources.